Ogadak Huju Indunjaba. Hello, all of my relatives. My English name is Misty Wilkie. I am Bear Clan, and I am an enrolled citizen of the Turtle Mountain Band of Chippewa, located in our homeland of Belcourt, North Dakota, which you can see right on the Canadian border in north central North Dakota on the right hand side. And then we also have some trust land across North and South Dakota and Montana, which you can see in the red areas. And before I go on, I would like to acknowledge the land that we are sitting on and that our ancestors that came before us and those that will come after us. The Dakota and Ojibwe people have occupied these lands that we are on. And I am so grateful for their strength, power, and wisdom that's been passed on through generations. I hope we can all continue to carry those traits with us. As I introduced myself in Ojibwe, I greeted you as hello, my relatives. And this is one of the things that I like to start presentations out with is reminding folks that we are all related. And that goes just beyond human relation, but relatives of our plants and animals and what's in nature. And just it gives a different perspective of how you think about things when you think that we're all related. And I think that we treat each other differently when we speak as relatives. I know a lot of our IHS and tribal health clinics refer to their patients and clients as relatives. And again, this just totally flips the narrative or the script of what you treat people like when they are your relative instead of a patient or a client. So I want to start out by talking about my roots. So as I said, my tribal homelands are on the Turtle Mountain Reservation, but I was actually born in Virginia, Minnesota, and my parents at the time lived in a very rural area in northern Minnesota on the Bois Forte Reservation. My dad worked for Bois Forte at the time as a police officer, and that's how I was born in Virginia. And when I was a toddler, we returned to our home reservation, and we were there for a short time before my dad accepted a position on the Spirit Lake Reservation in North Dakota. And I wasn't aware at the time that this would be the longest I had lived anywhere until the place that I currently reside in. We lived in Fort Totten for almost 7 years. So I went to school there from first grade to halfway through 7th grade. And because of politics and promotions, my dad switched jobs quite a bit. He was a law enforcement officer for the Bureau of Indian Affairs. So halfway through 7th grade, my dad accepted a position on Standing Rock Reservation. And because we didn't have housing yet, we ended up living in Mobridge, South Dakota, and thought we were going to get a house in Standing Rock. So my brother and I went to school in Standing Rock. I went for well, actually my brother did too. We went third quarter in Standing Rock and didn't get a house. So then we switched fourth quarter to Mobridge. So if you kept track, that's 3 schools during my 7th grade year. And I should also note that I'm quite a shy and introverted person. So these moves were not always the greatest fit with my personality, but I wouldn't change the experience for the world. So 7th grade, finished out in Mobridge, and then we got a house in McLaughlin, South Dakota. So I went 8th grade in McLaughlin. Ninth grade, my dad accepted a position on the Rosebud Reservation, so I went to school there from ninth to 11th grade. And then my dad got a phone call from the Boys Fort chairman going into my senior year, asking him if he would return to Boys Fort to be the chief of police. So my parents moved back to Nett Lake, and I moved in with an aunt and uncle in my home reservation in Belcourt, so I wouldn't have to start my senior year in a place where I didn't know anybody. So that's a little bit about my roots and where I come from, and kind of what influenced me along the way. Okay, so a little bit about my family. As far back as my family tree goes, we have come from the Turtle Mountains and the Métis people with a splash of Scottish ancestry. So I am a descendant of Chief Jean-Baptiste Wilkie, who is the son of Alexander Wilkie, who is of Scottish origin. And my maternal grandparents are Raphael and Marie Trottier. My paternal grandparents are Robert and Lucy Wilkie. And there I have a picture of my mom and dad, Richard and Patty. And then my children are Zachary, Quinn, and Avea. And I forgot to add my spouse. Do not tell him. I'm married to Rich. And I share my family history and my roots for two reasons. I am very proud of my culture and my family and my ancestry. And the second reason is pretendianism is becoming more and more prevalent and seems to be on the rise in academia. So short of sharing my tribal ID and my certificate of Indian blood, I want to be fully transparent about who my family is, where I come from, and the communities that support me. So I never thought that I would end up in academia. I never envisioned that for myself. As I said, I'm very shy and introverted as an individual. I try and overcome those traits as a professional. But you know, it wasn't in my nature to be a faculty, to be a teacher. In fact, any presentation I did while I was in college, I always had points deducted for lack of eye contact. So, you know, teaching was never in my realm of career possibilities. So how did I end up where I am today? And the answer to that is really in this quote: you cannot be what you cannot see. So I had the incredible fortune, and still do, to have some really awesome mentors along my journey, which started when I was at Bemidji State University, where I first learned about Dr. Roxanne Struthers. She was really the first person that I knew of that was American Indian and had a PhD in nursing. And at the time that I learned this information, there were 12 American Indians in the country with a PhD. And that's when I set my goal to become one of those American Indians with a PhD in nursing. So as I progressed through my nursing programs, I was often the only minority and generally the only American Indian. And it was at UND where I found out what it was like to be supported and understood as an American Indian student. And this was the first time that I had lived away from the reservation and away from my family. Zachary and I moved to Grand Forks so I could attend my master's program full time. And the staff at the RAIN program, the Recruitment and Retention of American Indians in Nursing, were really integral in my success there, and just feeling comfortable and welcomed and like I belonged. And that's not always a space that American Indians feel welcomed and included in higher ed. So that was really valuable for me to have the RAIN staff there. And when I finished my coursework for my PhD, I stumbled upon a job advertisement for and this was in spring of 2005, for a faculty position at our local community college. And I really had no idea what I was going to do with a PhD when I was done with it. Honestly, I didn't even know what somebody with a PhD did. I just knew that 12 wasn't a big enough number, and set this goal out for myself. So I applied for this faculty position at the community college, and I was very ill prepared for my first teaching gig. This was a group of LPN students in their final semester of school. It was a summer term, and I was the only faculty they had. And we had class Monday through Friday, 8 to 4:30. They knew I was a new teacher. I didn't have enough time to prep all the course materials. I was working long days to come up with lesson plans and exams. Like, I developed everything from scratch. It was not a good scenario for a first-time teacher, and for these students to be in their last semester before they graduated. Fortunately, I inherited the very extreme stubborn trait from both of my parents. So I refused to throw in the towel and give up on teaching. So I applied again and taught again in the fall, and I have taught every semester since. But I took what I learned as a student from those that mentored me, and I used my experiences to shape what kind of faculty I wanted to be. And when I started teaching at Bemidji State in 2013, my dream was to develop a program very similar to RAIN at UND. I wanted to offer holistic wraparound support services to American Indian, Alaska Native students. And really, that's how we work towards diversifying any and every workforce. So for as long as I was in school, or since I've been in school, which was in the late 90s, there's always been a nursing shortage. With COVID and an aging workforce, this has only exacerbated the shortage. Within 5 years, a quarter of the current registered nursing workforce will either retire or they plan on leaving the nursing profession. So again, we're going to have an even greater need for registered nurses. And for as long as I remember, American Indians have made up between 0.3 and 0.4% of the nursing workforce, and that holds true today. And the current demand for master's and doctorally prepared nurses for advanced practice in clinical specialties, teaching, and research far outweigh the supply available. So one of the things that my current students use as motivation right now for themselves and to get others into the nursing workforce is to get the needle to 1%. I hear them say that quite a bit. We need to be the 1%. So it music to my ears to hear them talk about increasing that number from 0.4% to 1% as they share their educational journey with others to motivate and inspire them to go into nursing. So within the Minnesota nursing workforce, we have about 165,000 RNs, and very few of those are American Indian, and even less so are nurse midwives or nurse practitioners. The University of Minnesota School of Nursing does have a really great collaborative relationship with Bemidji State's Nagano-Wini-Mananig program. I was a part of a pathway program when I was in my master's program. So this pathway was between UND and the University of Minnesota School of Nursing. And it just created so many opportunities for me to meet faculty at the U of M before I was even a student there. And so when it came time for me to apply to the PhD program, I knew faculty that I could reach out to and ask them to proofread my essay, or, just to give me guidance on the application process. And so that's the kind of relationship that we have with Bemidji State. We had a group of their students and staff come to the U of M campus last January. And I think one or two of those students that came applied to our DNP specialties this year. So, we're really working towards streamlining that pathway for American Indian Alaska Native students that want to pursue a graduate degree and take away any of that guesswork or barriers that are often encountered as you're entering a new institution or a new program. There are just so many unknowns and uncertainties that a lot of times keep students from finishing the process. So they might start the application, but then they encounter one barrier after another and don't have anyone to turn to, and so they never finish the application. So as soon as we learn about a American Indian or Alaska Native that's applying for our DNP specialties or our PhD program, we get connected with them and walk them through any issues that they might be having. So besides Bemidji State, there are other really great programs out there that support American Indian, Alaska Native undergraduate students. University of North Dakota that I mentioned, Montana State has the Caring for Our Own program. Arizona State has the INCATS program. So lots of great programs out there supporting undergraduate students. I believe we're the only program in the country that has as large of a, well, I know for a fact that we have the largest cohort of American Indian Alaska Native DNP students in the country. And this is something we're really proud of. We accomplished in a really short period of time. So I just briefly want to revisit the nurse midwives shortage. There's a prenatal desert from Canada to Nebraska. We have so many pregnant people, American Indian, Alaska Native, and otherwise, that are unable to get prenatal care because there are not enough providers. Last year, I spoke to somebody from the Rapid City area, and they had almost 100 pregnant people who were still waiting for their first prenatal appointment halfway through their pregnancy because there weren't enough providers. So we're trying to increase numbers in all areas of nursing, but we definitely could use more advanced practice, family nurse practitioner, psych mental health, nurse midwifery, etc. So I feel like I'm preaching to the choir here with what it means to have increased American Indian Alaska Native nurses, but I think we all know that it would certainly improve health disparities through culturally appropriate, culturally relevant care, um, help to address some of the shortages in IHS, tribal and urban facilities that are caring for our tribal relatives. Um, you know, establishing rapport almost immediately. I know there are a couple of other American Indians on this webinar today. But one of the things that, is very common to us is when you recognize somebody or think that somebody might be American Indian, your first question is generally, where are you from? And that doesn't mean what town are you from? It means what tribe are you from, or what's your tribal affiliation? And once you establish that, then you start asking about, well, who's your parents? Who's your grandparents? And there's always a connection, and it's remarkable. We always say that Indian country is small. There's always the degrees of separation that are pretty small with who you know and who you have in common within your personal networks. So having that rapport and recognizing that person as Indigenous speeds up that trusting relationship to where, we have greater influence and will be able to directly address some of those issues of non-compliance. And I have that in quotes because it's one of my least favorite things in the health profession is when we label somebody as non-compliant, because there's always a reason. I just do not know one single person in this world who would directly go against a doctor's orders, especially if it's going to negatively impact their health. And so to label somebody as non-compliant because they didn't take their medication or they didn't follow the proper diet, like there's always a reason. And so going back and finding out what that reason is, if it's insurance or lack of electricity, lack of running water, just getting to the root of the problem as to why a person is being labeled as non-compliant. So just addressing some of these unique things as we care for our own population are just is beneficial across the board. So that brings me to our pathway to doctoral education for American Indian Alaska Native nurses. This is an initiative that was started in 2022 through HRSA Nursing Workforce Diversity Grant, which was started to create a pathway for American Indian Alaska Natives to earn either a Doctor of Nursing Practice degree or a PhD in nursing. So we, as part of our program of support, and I'll talk more about this in a minute, we implemented a sustainable mentoring program because to me, that's really foundational for American Indian student success is having a mentor throughout their education. And then we also have a component where we are working towards indigenizing our graduate curriculum. So we want our students to see themselves represented and their cultural values and beliefs represented throughout their coursework. So Dr. Lisa Martin Renicky is the faculty involved in working with the School of Nursing to indigenize the graduate curriculum. And that is an ongoing effort. And, just thrilled that our administration is supportive of these efforts to make sure that We're not just bringing American Indian Alaska Native students into the school, but creating a full program of support for them, and have that ready and waiting for them as soon as they start their programs. So the goal of the Pathway Initiative is to increase the number of doctorally prepared American Indian Alaska Native nurses. So we need them working in advanced practice positions to serve as leaders in IHS, tribal and urban healthcare facilities, influencing policy, and creating change that's going to transform our tribal, urban, and rural tribal communities. Hopefully they consider becoming faculty in higher ed, and we also need a whole lot more Indigenous nurses. So this picture I have here is in Weaver Densford Hall, and this is my middle son, Quinn, on the day that I defended my dissertation. So I just had to throw a couple of cute pictures in there. And Quinn is also the reason that I will have to get off the meeting pretty soon after I'm done presenting, because he has a basketball game. He's a senior this year, and he only has a couple games left. So he went from this cute little 2-year-old boy to a grown 18-year-old senior today. So this is our faculty and staff involved with the Pathway Initiative. Dr. Margaret Moss is Mandan Hidatsa Arikara, and she also has lineage in First Nations Dakota tribe. And Dr. Lisa Martin Reneke is Lac du Flambeau. So they both serve as faculty mentors to our students, along with myself. And then JC Anderson is Turtle Mountain, Chippewa, and she is our recruiter and advisor. She works with students from the time that they express an interest in coming to the University of Minnesota to throughout their program, and is a support person for all of our students. So we have a holistic wraparound service for our students. Again, recognizing the need that you can't just bring students in and expect them to do well on their own. So we provide financial support to each of our pathway students. And this comes in large part from the HRSA Nursing Workforce Diversity grant that we have. We also get them connected to other scholarship opportunities within the university system, and the Twin Cities area and beyond. So a lot of our students come to us from all over the country. I think we have 5 that are from Minnesota, and the other 14 are outside of Minnesota. So just encouraging them to apply for as many scholarships as possible, writing letters of recommendation for those if needed, to be able to minimize the amount of out of pocket or loans that they need to take. Academic support, that looks like introducing student or prospective students when they express an interest, for example, with our psych mental health nurse practitioner specialty. If we have a student from Bemidji State that's interested in psych mental health, we can get them connected to the psych mental health specialty coordinators when they are in the process of applying, just so they can learn more about it, and if that's really the path that they want to go down. We also get them connected with students that are enrolled in that specialty currently, with everybody's permission, of course, so they can get a real picture of what that looks like to be a working student in that specialty. Because as a faculty, my perspective is way different than, what it's like to be a student as far as um, time management and, the amount of time it takes to read through all the articles and complete the assignments. Peer support is a big one. Our students do a lot of group texting and keeping in touch within their specialties and within the pathway cohort. And that's what I love most for them, is that this is the first time for a lot of them that they have had so many other American Indian students in their program. A lot of them were like me, where they were the only one wherever they went. And so, now there's 19 of them, and there's a lot of folks that they can call on for support or encouragement and motivation. And then providing the American Indian faculty mentors. Again, I think this is such a pivotal foundational part for our students to be able to connect with American Indians that also have a doctorate in nursing, because there are so many experiences that are unique to being a graduate nursing student, and having that faculty mentor really helps them walk through some of the challenges of those programs. The social support, we connect on Zoom every other week, and we invite those that are accepted to the program. For instance, we have 4 that have already accepted different their seat in different programs for a fall 2025 start. And we have sent emails to those incoming students asking them if they would like to be part of our Zoom pathway gatherings, just so they can get to know the current students and, ask any questions about, what should they be prepared for as fall semester approaches. And then we also provide a lunch and a dinner during Deep Week. So Deep Week happens once a semester, once in the fall, once in the spring, and they're on campus for the week. And we just create time for us to be together as a group. The Deep Week was a couple weeks ago, and we had one of our students teach us how to make bracelets. And it was such a beautiful time together. Somebody put on flute music, and we were just visiting and creating art, and it was a beautiful time. So being very mindful about carving out this time to spend together, because we have 12 different DNP specialties in the School of Nursing, and so they're spread out among a handful, so they don't always get to see each other in their classes. So these lunch and dinner times are just for our pathway students. And the last piece is cultural. So being intentional about planning cultural activities, getting students connected to other American Indian Alaska Native nurses or leaders in their specialty area, whether it's, nurse midwifery or family nurse practitioner. A lot of our students are in the health and innovation leadership track. So, anybody that has a leadership position, we do our best to get them connected to as many folks as possible so they can broaden that professional network. And then the last piece is NANA-INA. So that's National Alaska Native American Indian Nurses Association. And this is a national organization with American Indian Alaska Native nurses, other Indigenous nurses and allies, a great organization for our students to be connected to. And this creates opportunities for them as well, such as presenting. It's a safe space for them to present things that they're working on, either in their classes or in their professional careers. As I said early on, yeah, we're in our third year of funding. We started in 2022. Our grant funding does end June 30th, 2025. So we started out in year one with three students, and they just happened to be enrolled in three different DNP specialties. And then in year two, we had two that continued on in their programs, and we admitted 12 new students in year two. This year, we had 12 continuing and admitted 7 new. So as I said, this is the largest cohort of American Indian, Alaska Native DNP students at any institution. Very proud to have accomplished this in such a short period of time. And I think it's really a testament to, the work that the School of Nursing has put in to support students, and having three of the very few PhD American Indian, Alaska Native PhDs in nursing, all at the School of Nursing. Looking forward to expanding these numbers each year. I'm wrapping up here, but I was at a conference not long ago, and I heard somebody make reference to reaching the top floor in their career, and that they were going to send the elevator back down for others. And while I really appreciated this analogy, it didn't fit like my beliefs and how I see things. I'm not a I'm more of a circular thinker and achiever. I don't view myself as being higher than anybody else. And so then I came across this quote about being in the circle and we are all equal. No one is in front of you, no one is behind you, no one is above you, and no one is below you. And this resonated with me so much more. Also because I am an introvert, that I appreciate when people pull me into things, then I'm more likely to join. And so this is kind of how I think about my work, that the more people we can get into this circle of nursing, and the more American Indian, Alaska Native nurses we can bring into the circle, the better off we will all be. With this idea, just to add, I think we are helping our people to achieve their best by creating healthier communities, working more towards that health equity. And, I'm just really thankful for the mentors my mentors who have inspired and influenced me both personally and professionally. So I think because of my mentors' actions and their mentorship over the years, I have been inspired to help others achieve their dreams. And no matter what they might be, some come into nursing and decide it's not for them, and I'll support them on whatever journey they want to take. So this is our group of pathway students. This is 18 of the 19 students, and Dr. Martin Renicky and myself are in there as well. These folks are from across the country in pursuit of a doctorate degree to lead change and transform tribal, urban, and rural communities. And I could not be more proud to be part of their journey. So miigwech bisantawie, thank you for listening, and I would be happy to answer any questions if there is time for that.